Hi, my IG real life family. This is Dr. Ayisha coming at you with a brand new video. Let's talk about strokes, also known as cerebral vascular accidents. But here are some stats. In 2020, the CDC stated that 1 in 6 deaths were due to strokes. Every 40 seconds, someone is being diagnosed with a stroke. Unfortunately, every 3.5 minutes, someone is dying from a stroke. And 800,000 strokes are diagnosed annually. In fact, stroke is the leading cause of long-term major disability in the United States. So what are some signs and symptoms? Well, there's an acronym known as BFAST. B stands for balance. Is the person walking funny? Are they swaying? Are they falling? E stands for eyes. Is there any visual disturbances, floaters, blindness, or spots? F stands for facial asymmetry. Ask the person to show you their teeth. Do you notice any facial drooping? A stands for arms. Ask the person to raise their arms. Are they weak? Do you notice any drifting? Or are they completely flaccid and can't move their arm at all? S stands for speech. Ask the person to say a simple phrase, such as, "The sun is shining." Do you notice or observe any slurred speech? And T, the most important, is timing. If you notice or exhibit or have any of these signs, you must get to the emergency room stat. If you're exhibiting any of these signs and symptoms, please get to the hospital immediately because timing is of the essence. Stay tuned as I share with you my top 3 tips of what to expect, what questions to ask, and some uncommon signs and symptoms of strokes. You don't want to miss it. Pearl number 1. Some uncommon signs and symptoms of a stroke could include dizziness, the worst headache of your life, bladder or bowel dysfunction, numbness and tingling in parts of your body, swallowing difficulties, changes in your personality, mood, changes in your memory. Also, loss of taste, smell, or hearing. Upon arrival to the hospital, the physicians will perform some standard tests, and these include vital signs, blood work, an EKG, and a CAT scan of your brain. If the physicians are telling you that they didn't see a stroke on your CAT scan, but you still feel some signs and symptoms, then there are some tests and images that you can request. And this leads me to Pearl number 2. Some of these specialized images include an MRI of your head and neck, CTA of your head and neck, carotid Dopplers, echocardiogram, and even an official neurology consult. And these are all dependent on your clinical presentation, your diagnosis, and your past medical history to see if you're a candidate and eligible to obtain. Pearl number 3. What to expect if you are officially diagnosed with a stroke and admitted to the hospital? Well, expect to spend a few days in the hospital. Depending on your disability and neurological deficits, you may even be evaluated by a speech therapist, a physical therapist, and an occupational therapist. And depending on their recommendations, you may be referred to spend a few weeks upon discharge from the hospital in a physical rehabilitation facility. Choosing the correct facility is crucial because this is a place where you will receive therapy services to get you back to your pre-existing self. So utilize your friends and family to do the legwork and research for you. I hope that this video was helpful, empowering, and gives you the voice to speak up and advocate for yourself. Until next time, I am Dr. Ayisha.